Welcome everyone. I'm Dr. Ina Trevathan, and we are here for I hope your last class for your clinical rotation, right?
Yes.
Yeah, finally, you guys made it. So we'll go around the classroom and introduce yourself.
I'm Olivia. I'm in the informatics class.
Deanna, informatics.
Cecily, informatics.
Hi, Govinda. I'm in the informatics track as well.
I'm Mary Jane, informatics track as well.
Fantastic. I lost my screen. We didn't move it fast enough.
Wait a minute.
Okay, let's see. Let's get it full screen. All right, so I just want to go over the syllabus, which is our contractual agreement, between us, between you and me and the university. And this course, as you know, is 4 units. That means when we meet, we will be meeting for 4 hours. We'll have a little bit of a break in between. So this is the definition of credit hour. We've been over that in our last classroom, so if you guys have any other questions about that, let me know. And I'm also always available by appointment. We could do our virtual meetings like we've done before, or telephone or text. And let's go over the course description a little bit. This is your last one. Last class, okay. So for this semester, we are concentrating on for informatics techniques. So that means we're going to be putting together everything that you have learned over the past few months in all your other courses. So for this class, you're going to put a lot of system and designing into place. I know you already had San Jose Regional Medical Center, and you have your assignment. We will be talking about your project that is continuing that you started last semester. So for this format, we're going to be addressing the consumer's needs. How do we report back to the stakeholders? How do we report back to San Jose Medical to let them know that the project that we've been working on, and to be able to provide them the data, to be able to provide them in a reporting format that is professional. So that's what we're going to be concentrating on this semester. You're going to learn to evaluate the data, do some analysis of the data, and also the reporting. So the standards are the same. We're going to follow in the same standard for AACN Essential of Master's Education. This is the same standards that we've been following for this semester. And we've had all these learning outcomes, etc. before. So let's look at the course objective for this class. So what we want to go over this semester is explain the concept, theories, evidence, and science that define human-centered design. So I understand that the project that you guys are looking at, it's in relationship with employees, right? Looking at the processes, looking at how many hours or how many strokes that it takes them to get their work done. So that's part of the human-centered design that you'll be looking at. For number 2, we're going to be discussing informatics theories using the concept of human-centered design. User, your experience, how comfortable are you with some of the techniques and the technology evaluation and the validation of pilot testing. I know you guys are conducting the pilots now, right? You guys have started the pilot. Not yet? Okay, you'll be starting them soon? Okay. Number 3, discuss how technology is used in the delivery of patient care, and its use in supporting clinical nursing practice and the broader nursing organization, including nursing administration, education, academia, and nursing practice efficiency in a variety of healthcare settings. So you guys are looking at some inpatient, or any of you in the outpatient arena? No? What areas are you in? Are you in med-surg?
Doing ICU.
Okay.
Med-surg.
ICU.
Emergency. Are they considering the emergency as part of ambulatory care?
No.
Is it?
It's not inpatient.
Okay, that's sort of inpatient. Okay, because some areas look at emergency to be ambulatory care because people walk in most of the time. All right, let's see. Number 4, we want to evaluate the impact of healthcare technology on patient satisfaction with their total healthcare experience using a user's experience theoretical conceptual framework. Because what we're trying to do, even as an informatician, is to make the patient care a lot better, right? We want to improve quality. We also want to make it easier on the users and the people delivering the care to have more time with the patient, or to be able to document it better and to be able to retrieve information and data a lot faster. So that's why we concentrate. It's always about the patient. Number 5, analysis and appraisal of the impact of technology on nursing efficiency and productivity. I know that's what your project is concentrating on, looking at the productivity and the efficiency of it. Number 6, apply concept of information, privacy, security, and use in clinical nursing practice, healthcare setting, and the delivery of patient care using healthcare and consumer technologies. One of the things that we have to worry about is privacy. So people cannot access a patient's information, and so the information doesn't get in the wrong hands, and that you're also not dispensing the patient information with the wrong person when you're not authorized to do so. Number 8, discuss future trend in healthcare informatics with a focus on the evaluation of the electronic medical record, the EMR, emerging healthcare technologies, clinical device integration, telehealth nursing, and telemedicine, genomics, and leveraging big data. Number 9, so that's when we get to the end, is after we've gotten all the information, get all the data, is to synthesize the data, right? Synthesize the stuff that you learn and be able to apply it. Apply the knowledge and the design, development, and implementation of a technology innovation within the context of human-centered design and relative, I think it says, interactive technology design and validation to address a clinical practice, patient care, or organizational system-wide problem. So that's what the objective is all about. Oops, it's already, this is closing too fast.
Yeah.
There we go. Before I even finish, right? So let's look at some of the resources. It's the same resources that we've used before. You should have, and we talked about learning disabilities, so if anybody has any problem with learning disabilities, we need to talk to the Director of Disability Support Services. Attendance, everybody is expected to be in class, and if you cannot be in class, to let me know so we could make appropriate accommodation for you as needed. And we talked about before about academic honesty, the work that you are doing needs to be ethical. You need to be ethical about it. It needs to be representing your own work. So you have my cell phone number and my email address, and we will stay in touch. So the next thing I'm going to go to Blackboard, and we're going to go over the assignments and the activities we'll be covering.